Let me paint the picture for you. You've got a patient coming in. They're wowed by your amazing office, the beautiful exam room, the modern furniture, the high-tech equipment, and all the amazing imaging that you're showing them. And to address their complaints, you've made such a personal conversation about their needs and issues. And then you start talking about reading glasses, the same old solution that their parents and their grandparents have been using. We have such an opportunity to wow our patients with technology, and it's time to embrace the next technology in managing presbyopia too. Let's talk through a brand new generation of presbyopia eye drops.
This is a Defocus Media production. What's up, everyone? It's your favorite optometrist, Dr. Darryl Glover.
And I'm Dr. Jennifer Lyerly, resident optometry nerd.
And welcome to Defocus Media, optometry's #1 podcast, where we discuss the hottest topics, latest technology, eyewear, practice management, and more. So sit back, relax, and defocus.
Hello, welcome to a new episode of the Defocus Media podcast. I'm Dr. Jennifer Lyerly, and I'm here with Dr. Darryl Glover, sporting some lovely new glasses. Darryl, you look great.
Well, Jen, you know I got to be flying fresh, and especially if I'm going to be on a call with you, because I know you always are looking stunning, Jen, my friend.
Thank you so much. And I'm here with Dr. Jade Coats. I know that you're a world traveler, got a lot of exciting trips and vacations and optometry related travels coming up. So we feel so lucky to be able to sit down with you while you're like momentarily at your house.
Thank you so much for having me. This is a topic that, we're about to speak about even more frequently. So I'm excited to dive deep.
All right, Darryl, you've been talking a lot about how presbyopia is hitting you a little harder lately. I think we're all at that kind of like the top end of the millennials are entering presbyopia. But here's the thing about us millennials, like we're used to a lot of innovation, a lot of new ways of doing things. We're doing anti-wrinkle treatments already with our skin, keeping everything looking really good. We don't let our hair get gray and frizzy. So addressing the changing of our eyes is something we're on top of. We're ready to embrace new solutions. And so I think that's why it's kind of a perfect opportunity that we've got these new innovations talking about eye drops in the treatment of presbyopia when we have this big generation hitting their 40s. Dr. Coach, you're a little younger than us, though. So tell us a little bit about presbyopia in your practice.
Hey, so I am an emerging presbyope, so I'm right there behind everyone. But uniquely, I started my career actually as an optician. And this really gave me personally a strong foundation in patient care and the importance of this personalized solutions really from a very, very early age. Even as in my early 20s, this was something that I was selling and educating patient on the importance of glasses and the importance of all of the different types of glasses they needed depending on their working distance and depending on their task. And so focusing on each of the patient's lifestyles for me, whether it be progressives or multifocal contact lenses, or even I currently work in a cataract and refractive surgery, adding a fourth or an additional option to my patients is really, really an exciting thing versus just the original three that I've had in my arsenal up until now.
Jen, I don't know about you, but I love that optician background. I feel like when you have that mindset, you really know how to dig into the lifestyle. You really know how to have a conversation. You really know how to meet the patient where they're at. And I'm pretty sure Dr. Coates said it's really helped to elevate how you have conversations with your patient in the exam lane, and especially when it comes to a topic like presbyopia. There's so many people in the world that have presbyopia, and when I hear that word, I just think about opportunity. So that's why I know I'm deeply and super excited to have this conversation today, because I want to help my patients, and I want to get all the best practices and tips from you to be able to educate my patients when I get into that exam lane.
Absolutely. And of a very important note, this is not necessarily instead of glasses. Just like an optician would regularly prescribe, glasses or an optician would prescribe or fill a glasses prescription for computer or lifestyle or hobby or task. This is kind of the same thing in my idea. I'm going to be planning on using this for kind of a wide variety of solutions, depending on when the patient is needing it or wanting it.
I think, Darryl, you mentioned how many people are affected by this, right? Is it just normal birthdays? So 128 million presbyopes in the United States alone, but the overwhelming majority of them, 62%, are just correcting the problem with over-the-counter reading glasses. So these are not, when you look at the numbers, we've got some great solutions. We've got progressive, we've got task-oriented glasses, we've got monovision contact lenses, multifocal contact lenses, but most presbyopes aren't using any of those things. They're just grabbing readers off the shelf. So the opportunity to wow someone with additional options is really out there, really there. And so I think it speaks to the fact that the options that we have traditionally had aren't motivating people enough to be like, boy, I really wanted those progressives, or I really wanted those contact lenses, to actually get them to the eye doctor to pursue it. They're just grabbing the over-the-counter readers because that's what they feel like is the solution that sounds like the best of all those options that are not that exciting to them. An eye drop would be something that might make people feel a little bit differently, right?
Absolutely. And Jen, I'm not a hater, but I cannot stand over-the-counter readers. They drive me crazy.
All right, I don't think anyone on the show says their top choice.
Understandable. I tell patients, that's an option. It's not a wrong option, but there are other better options available. And usually, just educating especially the 60% that are reaching for the over-the-counter readers. Whenever I ask those 60%, like, do you really like that method? Do you want to wear that method? And they're like, it's okay for certain times, right? But maybe the ability to have that option of a more tailored solution when they go out to eat or when they play pickleball, or something more specific for their lifestyle is much more strategic. So just having options, they really don't even realize that there sometimes are options, like you mentioned, beyond the over-the-counter readers. And they just feel when they're starting to notice those early symptoms of presbyopia, I can just go get a reader when need to be. But, sometimes that's not necessarily the best solution. They're frustrated with putting them on, taking them off. And so again, going back to the offer that they have options like progressive lenses and multifocals, in addition to possibly a new eye drop to help be an adjunct based off of their needs and demands. So it's very exciting to know that there's like a customizable option, but just educating patients on what's available and that people don't have to settle for readers. They can if they want to, but they don't have to. Just makes them feel a little more empowered in their entire vision care.
Let's just pretend like we're your regular everyday patient. And so we are so lucky to live in a time where there's not one, but two FDA-approved eye drops for the correction of presbyopia. Give like a patient-focused, high-level overview. Like, how would you present that to a patient?
So I have an eye model. I like to show people, but I'm very visual. You don't even need an eye model. Even easier, I just explained that pilocarpine works by simply constricting or the iris sphincter muscle, thereby creating a smaller pupil. And this is known as the pinhole effect. And sometimes patients, if they're familiar with photography, sometimes patients are actually familiar with this pinhole effect. But by having a smaller pupil, this reduces the peripheral light rays and increases their depth of focus. And all of this is a fancy words for this is going to help improve their near vision with the goal of not impacting their distance vision. So that's just part of it, is it stimulates a muscle called the iris sphincter. In addition to that, it also stimulates the ciliary muscle. And with that, it might also help enhance the eye's ability to focus up close. And it's a combination of both of these two things that patients really appreciate, like the convenience of being able to decide, again, when they're going to be using this option. So I just educate them that there's two different muscles that it kind of works on, and a combination of both of those two things is how this particular product works.
So I'd like to give a shout out to the sponsors of this podcast. It's Oris's Pharmaceuticals, and they make the new pilocarpine formulation that we're going to be talking about today, which is QLOSI, which is a brand new pilocarpine formulation for the treatment of presbyopia. So our goal when we've got a pilocarpine eye drop is to create a miotic pupil. How are you presenting that to patients? I know you mentioned describing what's happening with the muscles and making that pinhole effect, but is there anything that you want patients to really understand about addressing presbyopia with an eye drop that's a miotic that they might get confused about otherwise?
Yeah, I really try to stick to like a high level overview of this when educating patients, because we know it's as simple as affecting the near point triad, right? And it could be something going back to accommodation and convergence and pupil constriction. We understand that from a doctor perspective, but breaking that down into further discussing how pupillary constriction really impacts the overall near point, I kind of further break it down and just explain that pilocarpine essentially constricts the iris sphincter muscle. And by constricting this, it creates a smaller pupil. And this is known as the pinhole effect. And again, sometimes patients might have a background in photography, or they might even have heard of this before. So the pinhole effect, whenever I mention it to patients, is not something that's too far outreach or something that they can't understand. But for this, I just explained that this reduces the peripheral light rays by having a smaller pupil, and thereby this increases the depth of focus. And with the whole goal of improving their near vision, and really with the goal of not impacting their distance vision either. And so it's a combination of constricting the iris sphincter muscle for a smaller pupil, in addition to stimulating the ciliary muscle, which further, a combination of both of those two things help enhance the eye's ability to focus up close. So it can be difficult to explain, but again, I just like to keep it a high level overview and just explain that their focusing is much more complicated than they realize. And unfortunately, now that it is gone, we're having to have this a high level overview of how their system has fortunately worked for 40 plus years. But sometimes it might be easier to just show them how we're going to fix it versus explain it.
I kind of been playing around. Have you guys ever passed a pinhole to the patient with their near card and be like, I'm trying to make it happen like this. This is the pinhole. This is what we're going for. Is that something you've ever done it in the office?
So I have not, but that is a really great idea to kind of help them understand smaller people. I could see how that could be beneficial in practice, in clinical practice.
Yeah, Jen, I actually love that idea. For me, I like to dumb it down as much as possible, right? I'm not as smart as Jen, so I want it so that if I was on the other side of the chair, that I could understand it, right? And I think, Dr. Coats, you hit it, just high level, just break it down, give them a quick overview, maybe hit them on a few buzzwords that resonate with them quite a bit. And if you can actually show them or even have some kind of visual aid, I think that'll go a long way. I think it's very important for us as eye care professionals to understand the importance of education. Our patients are coming to us because we are the experts, and it's up for us to be able to communicate in their language, right? So it's really important to sit down and have a conversation prior and just understand who they are, how they like to learn, how they take in information. That way you can connect the dots, because there are tons of great options out there for presbyopia. And, these drops are going to be, another option, another resource.
And oftentimes patients really appreciate understanding this mechanism of action, even though sometimes it can be difficult to explain. These are the patients who might initially have thought that it was so simple that I can just go buy and get, some readers, over-the-counter readers. And then when you do start to explain all of these muscles involved and how there's all of these working parts and how it declines over time, sometimes that can really hone in the point that presbyopia is not going anywhere, and even furthermore why we need to treat it and kind of tailor it to their lifestyle. So again, sometimes, although difficult to explain with education from an anatomy perspective, for some of those patients, that's really, really valuable in them continuing the care.
Absolutely. I think it's one of these things that we're going to have to get very comfortable with talking about. And all of us are developing our script and our dialogue and the keywords that are going to really resonate with our patients. I have not been using the pinhole, but when you were talking about the pinhole, I was like, oh, maybe I should think about doing that. I will say, and again, this is not for the most scientific of my patients, because your explanation would really meet their needs better. But I have been relating what's happening to, like, do you know how you see better when it's bright lighting? Well, the reason why that is that in bright light, your pupil constricts. It gets really small, and that makes a more extended depth of focus. So I'm basically, with this eye drop, fooling your body into thinking it's in bright light at all the time until this drop wears off. And that little, 2 sentences seems like it's like, oh, okay, yeah. And so for some of your patients, it might be as simple as that. And for other of your patients, they might need a little bit more about what's happening with the muscles. But I think we can have a few little keywords about how to describe it that for most people is going to make them feel comfortable about what's happening.
I love that.
And Jen, the other thing too is you have to smile when you're saying this, right? You have to have confidence when you're having this conversation. The last thing you want to do is have a conversation and you're sitting there just in that monotone or just not with a big smile on your face, because then your patients are going to not trust you. You got to remember, you're the expert, right? So we got to feel confident in our responses, confident in our explanations, and confident with the resources or drops that we have at our fingertips as well.
Mm-hmm. I honestly start a lot of my presbyopia conversations with, if this makes you feel any better, this happens to, every eye doctor who's blessed to also have an I mean, I'm not immune. You're not immune. I mean, it just is what it is. But let me help you, and we'll go through this together. So I do agree that kind of saying it with a smile on your face absolutely can gain trust.
Yeah, just bring the energy, the good vibes, make that patient feel confident, right? So
you are not dying from presbyopia. It's all good.
I'm going through it too, and I can smile. Let me share.
Exactly.
Right. Well, let's talk a little bit about the ideal patient candidate, because I feel like obviously when we're talking about pupil constriction, there's certain patients that are involved in the patient types that are involved in the clinical trials. But what makes a good patient? If you wouldn't mind kind of going through some of the things you're looking for when you present this option.
Sure. So whenever I consider who's going to be like a good candidate for QLOSI, I'm going to really reference the clinical trials. And so in the clinical trials, they actually tested age 45 to 64 years young, prescriptions of -450 sphere to +2. And in the clinical trials, there was no history of LASIK or cataract surgery. So when I first get my hands on this medication, my best candidate for the QLOSI will be typically a patient with mild to moderate presbyopia. An ideal candidate would maybe be someone in their early 40s or mid 50s, someone who maybe still has a little bit of pupil response or accommodation still left. I could see how that could be beneficial in addition to a little boost. But an ideal patient, in my opinion, would have a low refractive error, particularly like an immatrope or even a low hyperope. And the main thing that I think that is very, very important is they need to be motivated to want to fix this.
Good point.
Right. So of all of the key factors, again, if someone doesn't want to use it, then I'm not going to force it on them. It's just going to be an alternative. Would you like glasses, contact lenses, refractive surgery, or eye drop? So again, that motivation factor, same as multifocal contact lenses. I mean, you're not going to fit someone who is not the most motivated, who doesn't even want to be in multifocal lens. Like, you can just tell it's just probably not going to work out, or someone who might be skeptical. So I'm going to be keeping it to the patient who would be the best candidate based off of their clinical trials.
So I like that overview there. Let me ask you a question, Jen. I'd love to get your perspective on this as well. Jen, we come from the same cloth, right? We grew up and practiced together. We've done a lot together, and we kind of practice the same way. When I write out scripts, I always write out 3 scripts: distance, computer, sunglasses. Should we look at this with that candidate profile that you just mentioned and also add a presbyopia drop to that mix as well? Because it is another option that's available if we are talking about someone that's 40 plus or presbyope. So maybe it is a progressive, maybe it is computer glasses, maybe it is sunglasses, and maybe it is a presbyopia drop, as long as they fit their profile. I mean, what are your thoughts in regards to that? Because I like to always be cutting edge and, doing things other doctors aren't doing, but I think that might gain a little more traction, especially in this category moving forward.
Yeah. I mean, I definitely think, like you've mentioned several times, Dr. Coats, that we need to present this as an adjunctive. It's not necessarily like, oh, you'll obviously they're going to need their distance correction if they have a set. So it's not like, oh, you're doing this or you're doing glasses. This is an and situation. Maybe sometimes where you don't want to wear glasses, this would give you a little bit of a boost where you can still get through. Maybe it helps make your glasses work even better for you. So definitely it's not your patients only that don't wear glasses or don't wear contact lenses. It's definitely an adjunctive thing. And they don't necessarily have to use it every single day, which I also think is great. Sometimes they might be a day where they're just around the house, they're wearing their glasses. Some days they're out and about. Maybe they want to use the eye drop. And I think mixing and matching it works really, really well. But I think, they have to be willing to put an eye drop in. And I also think it's so I want to underscore that in the QLOSI clinical trials, there were no retinal side effects.
Peripheral retinal evaluations were absolutely performed prior to the treatment and the selection process. And I absolutely will plan to do the same, in addition to educating them on potential signs and symptoms, as I do for all eye drops that I prescribe. So it really doesn't change anything in that education process. But again, just so that they are aware, I do think that it is good practice to have a peripheral retinal exam. Something else to consider too, that I don't think I mentioned earlier, but in addition to motivation, would be a consideration of the lifestyle factors. I mentioned that I love that you mentioned an adjunct, because I plan to ask my patients, of your glasses, contact lenses, is there any time where it could be better? I want to figure out, my plan is to figure out when they need, and I'm going to kind of tailor my initial discussion to maybe trying it there.
Well, I think, part of this too, like you said, is setting expectations. Like, how would this drop fit in? What do we expect? How do we define success? Which is, again, no different than the conversations that we have around any of our presbyopia solutions. We define success when we talk about progressives. We define success really a lot when we talk about multifocal contact lenses. So how do you talk to your patients based on the clinical trial data about setting expectations for success?
Sure. So again, setting expectations is crucial for everything, including glasses and contacts, but especially with miotic eye drops, right? So letting the patient know that they can improve, that the potential, according to the data, to improve their near vision by about 2 to 3 lines on the reading chart is what we consider, functional vision. And our goal of this functional vision, I think, is a really important topic because, what is functional vision? Do we need crisp 20/20 at near in dark, dim illumination at dinner? Likely not. We need to just be able to see our menu. We need to be able to accomplish our goal. Do we need to wear readers while we're playing pickleball? Probably not recommended. But do we need a little extra help to see our scorecard or our racket, the details? Yes. So setting that clear expectation of what is functional vision, what is a realistic goal, I think is important. But I do use the examples of like reading a menu, checking their phone, goals of not having to push out their focusing whenever they still have a multifocal in dim illumination. But I also let them know that there is a binocular effect that can take place with pilocarpine, and using eye drops in both eyes can have an enhanced depth of focus with overall visual quality. And so it's really important to note that in addition to all of these things, our goal, QLOSI's goal, is not only improving near vision to a functional level of improved 2 to 3 line near gain, but it's also without a sacrifice at distance. And that's really kind of unique and key. But QLOSI actually was measured, the binocular effect was measured versus just a monocular effect. And that's uniquely different. But we don't work with just one eye, right? So our binocular system and our near focusing, the whole equation is dependent on 2 working eyes if we have them. So again, I really like that there's likely a binocular effect benefit with the 0.4% pilocarpine.
I love that you're touching on all these points, because we may have patients that have come in that have used a previous presbyopia drop and it just didn't deliver. And now we have the answers to say, hey, this is why it didn't. This is going to provide this. So all those things that they might have not been able to achieve previously, we now have a response to be able to educate those patients, because those patients may be great patients. They may not be so great because they might have had a bad experience, or they might have had an okay experience. And you may be able to give them something that may be more cutting edge than what they had previously as well. So it's great that you're able to review that with us. And
if they were to I would challenge them to maybe use it for at least 2 weeks based off of this data, or 15 days, to see if they maybe had more effect later versus the first day.
Yeah.
Something else that is, again, really, really cool is that a second drop can be used. And so a second drop can be used 2 to 3 hours after the first one. So again, knowing that and having the patient kind of play around with it and figure out when's good for their schedule and their timeline, I think just gives them this really cool freedom to be in charge of their vision when they want to be. So.
Yeah. I love that. I feel like we now have a better conversation around what the patient journey is going to actually look like, right? And to be able to educate them that it's going to improve in 2 weeks. To be able to improve in 2 weeks with the drop, think about all the dry eye treatments and managements we have out there, right? There's not a lot that could do that or help with dryness in 2 weeks. So to be able to educate a patient, this is something that we already do in our practices anyway. So it's just good to have that conversation that, it is going to improve after 2 weeks of use. You just got to be patient and just kind of ride with us throughout this entire process.
And important to note, as an optician, if I were to prescribe a new progressive lens to someone, how long do we tell them to wait?
2 weeks.
2 weeks. So again, it's literally tomato. But there's adaptation to it all. Same thing with multifocals. We're like, no, call me in 2 weeks.
Yeah.
And so same thing. They just need a little bit of time, a little bit of education. But I think it would be really worth our time and effort, because we would be the eye care providers who would be able to kind of own this category.
Very nice.
I think just shouting out some of the clinical trial data. So, doctors might be listening to this and thinking like, all right, we've learned quite a bit from 1.25% pilocarpine to QLOSI. We've learned about the neuroadaptation that can happen, where if you hang in there, keep using it, the vision does look like it's getting better and more effective, right? We know about the second drop now, increasing the length of time that the effect wears off. But one thing that I think is a little sneaky that people may be not noticing is that 3 lines or greater near visual gain. In the QLOSI clinical trials, in the first 2 to 3 hours of drop use, right? This is a huge leap forward, actually, when you look at the clinical trial data, and we know so much more about how to set our patients up for success, about how it's going to work, what time you need to give it to work to its best effect, and using that second drop. So I do feel like we're more equipped now to have effective messaging with a pilocarpine drop. So what is it about QLOSI? We know that it's 0.4% pilocarpine, which is a lower concentration of pilocarpine than the 1.25% pilocarpine that was our first generation of presbyopia eye drop.
So QLOSI was designed very thoughtfully with this unique EYEQ formulation. It's very clever too. But this is not just any formulation, because they were right. They can't just be another pilocarpine to the table. So they decided to set themselves apart by not only being the lowest effective concentration of pilocarpine, with being 1/3 the concentration of currently available medications, but there's also a near neutral pH, which this helps essentially increase the bioavailability and the efficacy of this of pilocarpine. It's preservative free, which is absolutely imperative as someone who cares about the ocular surface and treats dry eye.
Absolutely.
Preservative free is music to my ears. It also has an HA, hyaluronic acid, and HPMC lubricating agent for comfort. So it is really, really groundbreaking in this uniqueness of all of the categories, everything that I wanted in a pilocarpine. If I could have designed like my ideal pilocarpine drop, it absolutely would have been comfortable. It would have been effective and, again, preservative free. And so the fact that they have been able to incorporate all of these things, it was really designed for QLOSI clear moments.
That's so great. I think it's so exciting to have a drop with a lower concentration that you've maintained actually shown, not just want to say maintain the effectiveness, and it doesn't sting or burn with near the intensity because it's preservative free and a neutral pH. So fabulous. I know a lot of problems solved, and a lot of, again, doctors might be listening to this episode and thinking like, pilocarpine, I don't know, I tried that, maybe that didn't work. I had negative feedback from my patients, but we've got to come in this with the mindset right from the start, like, this is not the same, this is different, and there's a lot of reasons that it's different, and those 4 components are a big reason why this is different for our patients.
Hey, Jen, that's why I love this podcast, right? Because we bring out the latest and the greatest news, right? There have been, our colleagues out there that have had bad experiences with previous drops that maybe didn't get across that finish line. But at Defocus Media, we like to always, create a platform for everyone to, educate about the latest and greatest technology. And I feel like every time we have a new podcast, Jen, we're taking it to the next level over and over and over and over again. It's exciting times in eye care, honestly.
It really is. And of important to note, QLOSI during this launch process is really making an initiative for this to be prescribed by eye care providers. And so that's something that it was different with the first prescription 1.25% pilocarpine, was that a lot of the initial prescribers were not eye care providers. They might have been dermatologists, or an internal medicine doctor. So I do think that this is an opportunity for eye care providers to really own this space.
Surprising stat when you hear that about who the prescribers of 1.25% pilocarpine were on that data front. And so eye care definitely was not the big player in that space, but here's a drop that's coming to eye care specifically. And it obviously, we're the best able to have these conversations with our patients and to make sure that the patient is the best candidate for it, because we're going to check the health of their eye before we prescribe a drop for this. So we're going to do it safely, people. So how would you, let's say we're ready to roll. We've got this drop approved by the FDA already, right? We're ready to start writing prescriptions. What do you intend for follow-up scheduling, or how do you plan to follow up with patients when you are getting them this medication?
So my initial rollout is obviously, like I mentioned, they need to try it for a period of time. So with a goal of 2 weeks. So when this first rolls out, I plan to reach out to these patients to see how it's going. I would like the opportunity to kind of adjust as needed or tailor it to their lifestyles. Or like I said, if they needed to use a second dosage 2 to 3 hours after the initial one, that they could. But my ready to roll is I am starting essentially a list, and any eye care provider can start incorporating this like right now by identifying the perfect candidates or people who you think would be a good candidate, so that when you do get your hands on this, you can just roll it right out. But essentially those in the early stages of presbyopia who are most motivated in reducing their dependency on spectacle or contact lens correction. I think that my goal is kind of educating my whole staff so that everyone feels confident in discussing how the drop works, and asking my patients what they're interested in and where we can improve their current setups.
Reduce the dependency on your glasses, because that's exactly the phrase that I'm using when I make my list of people. And if they say yes, I'm like, perfect, you're a candidate. What about you, Darryl?
Well, one thing I was going to say also that we can look at is whenever we have our intake forms, we can actually write out presbyopia drops, just like we have glasses and contact lens. Even if they're not aware of what that is, it's going to spark a conversation. It's going to have some type of dialogue that's going to build around it. So I think if we can do that, that might get those motivated patients that you were talking about, because they're going to be intrigued and want to learn more and may want to, experience it at some point in time as well.
Exactly. And the motivated ones are the best at giving their honest feedback, and so I like I said, I plan to start with a small group of very motivated patients who are trying to gain experience, gain experience in an alternative option, but they have the strong will and want to try it. So again, I'm very excited to try these things. And as an optician termed optometrist, this is going to be something I offer in addition to glasses and contacts and all of the sunglasses and assortment of spectacle corrections I do all day, every day, but just as an adjunct to make it that much better when they need it.
So I think that this conversation, we've got the excitement running again. Y'all, if y'all have been paying attention, I think you can see there's excitement here in this room. And I think we've given you a lot of reasons why presbyopia eye drops need to be back to the forefront of the things that you're presenting to your patients as a solution for their near visual issues. So when can we start to be able to, we know we have FDA approval for QLOSI. When can we start writing prescriptions for QLOSI?
So it is closer than we realize. In just a few short weeks, we will likely have people, part of the ORASYS crew, who are deployed out to our offices and who will be willing to help. So to answer your question, probably sooner than later, before summertime.
Yay, so exciting. Thank you so much, Dr. Coats. We really appreciate your time today and helping share some of this clinical data to get us set for offering a brand new solution to our patients. And I can't wait as we get the chance to write prescriptions to kind of circle back and share some of our stories and how patients are responding. So the conversation is just beginning.
Thank you so much for joining us. And as a final reminder, as with all pharmaceutical agents, QLOSI may not be suitable for every patient. Individuals with known hypersensitivities to pilocarpine or any component of QLOSI should really be avoided at all costs. And as previously noted, although rare and cases of retinal detachment have been reported with use of miotics, it's important to perform a peripheral retinal examination to rule out any pre-existing retinal pathology prior to initiating treatment. In clinical trials, the most commonly reported adverse events were installation site pain and headache, occurring in approximately 5 to 8% of patients. And for complete prescribing information, please visit www.closiecp.com. See you next time.
All right, colleagues, and it's a wrap. Thank you dearly for hanging out with the Defocus Media team. We hope truly something resonated with you. And if it did, be sure to give us 5 stars. And make sure you follow us on all social media platforms: Facebook, Instagram, Twitter, LinkedIn, you named it. And our handle is at Defocus Media on all platforms. And until next time, be sure to keep it 2020. And we look forward to seeing you on the next episode. Indication and usage. QLOSI. Pilocarpine hydrochloride ophthalmic solution. 0.4% for topical ophthalmic use is a cholinergic receptor agonist indicated for the treatment of presbyopia in adults. Important safety information. Contraindications. Hypersensitivity. Warnings and precautions. Advise patients to not drive or operate machinery if vision is not clear. Example, blurred vision. Exercise caution in night driving and other hazardous occupations and poor illumination. Rare cases of retinal detachment have been reported with miotics. Examination of the retina is advised in all patients prior to initiation of therapy. Advise patients to seek immediate medical care when sudden onset of flashes of light, floaters, or vision loss. QLOSI is not recommended to be used when iritis is present. QLOSI should not be administered while wearing contact lenses. Remove lenses prior to installation of QLOSI and wait 10 minutes before reinsertion. Avoid touching the tip of the vial to the eye or any other surface. Adverse reactions. The most common adverse reactions, 5% to 8%, are installation site pain and headaches. Please see full prescribing information here. QLOSI.com/prescribing-information.